So thank you guys all for joining Pre-Health Shadowing. We are an international student-led, women-led, and minority-led nonprofit for medical advancement. We do have closed captions available to accommodate students of all abilities and needs, and if you have any ideas on how we can be more accessible, please email us at info@prehealthshadowing.com. Make sure to save us as a contact to keep us out of your spam and join our email list to never miss a session. And if you would like to stay in the loop, please make sure to sign up for our email list and follow us on our social media. Our handles for Instagram and TikTok are the same at Pre-Health Shadowing. And we do host students from all over the world, so type in the chat where you're calling from today. I'm calling from Texas. And if you're interested in being a part of the Pre-Health Shadowing team, we do have opportunities for student volunteers and team members. And we also have opportunities to join our leadership team. Now, all of our positions are 100% remote and we are actively recruiting, so make sure to sign up on our website. Here are just a couple of the roles we do have available, but the list is really extensive and you can see all of those details on our website. If you're a high school student, make sure to join our high school training program, HTP, which is offering leadership and healthcare education for pre-college learners. And if you can, please donate to help our program stay free and accessible to everyone. We do run solely off the time and donation of our volunteers. If you have any questions at all throughout the session, make sure to type them in the chat so that we can ask them to a professional. Make sure that you are taking good notes, as our post-shadowing assessment will be available to take to earn a digital certificate verifying your hours on a professional's course page at prehealthshadowing.com. And please, if you can, turn your cameras on to help us stay as true to a shadowing experience as possible. A little face-to-face can come a long way. And now on to a professional to introduce herself and give us her story.
Great. Hi, everyone. So I'm so excited to be invited to give this talk today. So I'm Dr. Renee Bullock-Palmer. I'm a cardiologist in New Jersey. So for those of you probably from New Jersey, Philadelphia area, I'm just in your neighborhood. So I practice at the Boer Heart and Lung Hospital, where I direct the non-invasive cardiac imaging program as well as the Women's Heart Center. And I also have specialty interests in not only women's heart health and general cardiology, but imaging and amyloidosis. So I'm really thankful to be invited to give a talk to this very important group because as you will see my slides, this is exactly the group that we're targeting to invite into our field of cardiology and then medicine. So let me delve right in. So just confirm, are you seeing my slides?
Yes,
okay, great.
perfect.
All right, so I have no disclosures. So I'm just going to give a broad overview of medicine, and particularly I'll hone it down to cardiology. So, you know, the medical field is really, there are a lot of players in the field, right? You have the nurses, you have the pharmacists, you have the nurse practitioners and physician assistants, medical assistants, and of course, physicians. So the field of medicine is very broad. And for those who are in high school, medical school, you know, the menu of professions in the field are quite variable. And that's why, you know, whichever talents or interests you have, there's a spot for you in the field. So I can tell you for medicine, you know, in terms of being a physician. So really, you know, the pipeline for us really starts from middle school and high school, and really getting honing your interest and really, you know, fostering a sense of you know, of appreciation for the sciences, so biology, physics, chemistry, biochemistry, and then really trying to do your best in those subjects. And you know, as you'll see later on in my slides, there are opportunities for high schoolers in terms of outreach scholarships to really harness all of the talents that you have to, because at the end of the day, what you really would like to do is to have that resume that shines when you're applying for medical school and ultimately residency and fellowship. Now, from a nursing perspective, I can't speak much to that, but my mom is a nurse, so I'll give you that perspective from her. And usually with nursing, there are varying fields of nursing. You have bedside care, inpatient care, you have outpatient nursing, you even have nurses that specialize in the operating room, surgical nursing, and then you also have varying levels of nursing. So usually a bachelor's of nursing is the first level. Then if you want to really be an independent practitioner, there's a nurse practitioner's program, which is another layer of training. And then for some nurses, they choose to go into administration, business administration, to really lead the service line in nursing. Same is true somewhat for physicians. There are some physicians that may choose to go more on the administrative side of business. So what tends to happen is that a lot of us as physicians, as we progress in our careers, we get older in our careers, we then sometimes choose to go into administration, learning, leading, institutions and healthcare systems. So there are varying layers, and these are opportunities where within your own field, once you're in the field, you can pivot into different disciplines. Some physicians may choose to do education where they may not see patients as much, but then they teach trainees, medical school students, residents, fellowships. So it's a very broad program. Pharmacy is also another wonderful area where you can have a very successful practice. Some pharmacists may choose to have a solo practice where they have and own their own pharmacy, or you may choose to be an employee at a large pharmacy like CVS, Rite Aid, Walgreens. So those are other opportunities. Now, looking at a research scientist perspective, so with medicine, there's bedside medicine, taking care of patients. Then there's also the research side where you help to develop medications and help to develop various equipment that can be used to take care of patients. So that's like bioengineering, PhD in research. So some physicians may actually not only have an MD degree, but then they may choose to do further research in a particular area and then have a PhD degree. So those are the varying, that's a broad overview of medicine. So I'm going to tell you a little bit, my first few slides will tell you a little bit about my story, my mentors, and sort of lessons I've learned along the way. And then the end of my talk, I'll go into resources, some words of wisdom, and then opportunities that are out there for scholarships, particularly for high school students and also, pre-med students. So my career journey actually started in Jamaica. So I was born in Jamaica. My dad is my inspiration. He is a physician. He takes care of what we call a family physician back home, where he takes care of anything that walks through the door, from the pediatric group all the way up to adults and varying parts of medicine. He takes care of patients. So he was the reason why I entered and chose the career of medicine. So for the same may not be true for others. Some people have that realization later in life, in high school, sometimes even in undergraduate. But for me, my interest started from, I would say, from elementary school. So in elementary school, I, did my best at all of the subjects that were presented to me at the time, and really through that ability to get the grades I needed, I then got into medical school in Jamaica. I think before the medical school stage, so for high school and for those in the audience who are high schoolers, what you really want to do is you want to have a broad palette of subjects, but I think you definitely have to have the key sciences. So biology, chemistry, physics, those are the three key areas of science that I think are strong for those who are considering a career in medicine. Mathematics is also very important because, in medicine, there are a lot of calculations, and I think that's a very good subject to have. But in addition to that, I think a lot of medical school applications, when they're choosing candidates for medical school, I think there's not just the IQ and the grades, but then there's a certain level of emotional intelligence that's needed. So if there's an opportunity for you to do outreach, like taking part in a health fair, taking part in a community outreach program. They're really looking for candidates such as those. So not just getting good grades, but also just being an overall conscious, socially conscious person, and really having that emotional intelligence that the field requires. So once I got into medical school in Jamaica, it's a 5-year program in the Caribbean. So it's sort of built on the medical school structure in the UK. And once we go into our pre-med, for the first 5 years, it's really pre-med where we're doing biochemistry, we're doing pharmacology, and then the last 3 years, you're really, you get introduced to the hospital, you get introduced to bedside medicine, taking care of patients, and then towards the third and the fourth and fifth year, you're really doing a lot of participating, helping in operations like being a third assistant, helping to deliver babies, which was very exciting, and then also the medical side of things of listening to the patient, examining the patient, having a treatment plan for the patient. So, the 5-year program is really intense because it's a condensed program. And once I was finished with that, for Jamaica, the government had mandates that we all have to do an 18-month internship. So I did my internship in what we call the public hospital system. I chose that because that system serves the underprivileged, and I really wanted to get back to that community. At the same time, it was very under-resourced, but then because of that, you sort of really hone in on your medical talents, and really you guided the ship when you were there. So, I mean, we took care of surgical patients. We delivered babies again during the internship, pediatrics as well, and then, of course, general medicine. So after I was finished with that 18-month internship, I then had the opportunity to migrate to the US. So my mom was actually recruited as a nurse ahead of and then our family got our green cards to come here. So my entry into the US was actually in Florida, where my mom practiced. And during that time, it's a very, there are lots of exams that you have to do as a foreign medical graduate coming into the United States. So there's the USMLEs for those who are in pre-med, maybe familiar with those exams. So there's several parts 1, parts 2, parts 3. So I did part 1 and part 2, and that was a requirement for entering into residency. During that time, I gained some experience shadowing in a medical internist office and also an ophthalmologist office, because my first love was actually ophthalmology. I'm dealing with the eyes. And so that whole process of what you call matriculating into the US system took about probably 18 months or 2 years. And there are 3 exams that we had to take: was USMLE Part 1, Part 2, and then the clinical knowledge examination. And because my interest was really in the Northeast, primarily because my fiance was in the Northeast, I sort of focused on residences that were in New York, New Jersey, Pennsylvania, and Connecticut. The things that I looked forward as applying for residency is because I was initially interested in ophthalmology, which is very, very competitive. And although I had a 99 percentile score as a foreign graduate, I did not get accepted into ophthalmology. But you'll learn in life that to always have to have a plan B. So of course I said, okay, ophthalmology didn't choose me. And I then went into internal medicine residency. I was fortunate to be accepted in SUNY Downstate in New York City, in Brooklyn. And there I really had an opportunity to meet a lot of mentors in internal medicine residency. My first mentor is actually a professor who was from Ireland, Dr. Edmund Burke. And I was fortunate enough in that he was actually an external examiner for my medical school back in Jamaica. So he was very knowledgeable of the medical school system there. And that sort of made me feel comfortable knowing that someone who knew where I was coming from and sort of understood my culture. That was really helpful. And also what was helpful in Brooklyn is that we have a very large West Indian population there. So I felt very at home in New York. And that the internal medicine program takes about 3 years, right? And then after that third year, you have the option of doing an extra a chief residency year, which I did because I think that was an opportunity for me to really hone in on my leadership skills. So during that year, it's a completely administrative year where you are teaching the residents, you're sort of planning the schedule for the residents in the first, second, and third year residents. You really also serve as a mentor to the younger residency candidates like interns and second years. And during that time, I also had the opportunity to start my family. I got married my second year of residency, and I started my family 2 years later as a chief resident. And I think that gave me the opportunity to actually have a less busy schedule because you learn in life that medicine is a very it's a very rewarding career, but it's a career that's very busy. And I always tell people, especially females, that there's never a right time to start a family. You sort of have to choose what's right for you. So that time was right for me. I started my family. And then at the end of my chief year, I got accepted into cardiology fellowship, which is another layer of training. So for residency, that's usually 3 years. If you're doing a surgical residence, that's 3 to 4 years. And then fellowship is a post-residency training. So, once you do medicine residency, you can either go into any of the medical subspecialties like cardiology, GI, which is gastroenterology, endocrinology, nephrology, which is dealing with the kidneys. So I chose cardiology, which was which is a 3 year program again. So I stayed on at SUNY Downstate and did my fellowship there in cardiology. Again, there I had an opportunity to meet many wonderful mentors that really guided me throughout my journey. And during that time as well, I really had an opportunity to, write, papers, get published. I think I had probably one or two publications during that time. I had also the opportunity to participate in research and present an abstract. And I hadn't developed an interest in cardiac imaging very early in fellowship. So cardiac imaging is a subspecialty of cardiology. So with imaging, you're looking at like using ultrasound to look at the heart, which is called an echocardiogram, CAT scan to look at the heart, a CT scan, and also nuclear imaging, which is an X-ray type of approach to look at the blood flow in the heart. So those are the three areas of imaging that I gained interest in. And I had an opportunity to do an additional year of cardiac imaging in New York City at Columbia University in Manhattan. So that made me PGY 8. So I was 8 years out of medical school. So as you can see, it's a long road, but as I'll tell you later on, very rewarding. So with after I had my training in imaging, which was in Manhattan, I then had the opportunity to be recruited to where I'm currently now, back in 2010 in New Jersey at the Broad Heart and Lung Hospital. And this was really through the grapevine that I learned of the position here. And back in 2010, I started as a very junior attending. And there's never a perfect job. There are challenges to every job, but I think, in life, you have to sort of roll with the punches and really, know that, okay, you have to have a line drawn in the sand. And if that line is not met and you're able to succeed and really excel in your field, I think sometimes you have to take the good and the bad. And I've had a wonderful journey here. I'm currently 14 years into this position, and it really offers me an opportunity. Because I'm at a small program, I sort of wear many hats. So I take care of patients, general cardiology patients. I also take care of female patients with women's heart health. I also do imaging. So in any particular day, I might be doing an ultrasound of the heart, reading echocardiograms. I might be doing a TEE, which is a special echocardiogram, which is like an endoscopy where you pass a probe into the stomach to take pictures of the heart. I might be in the afternoon reading a CAT scan, teaching the fellows, reading nuclear stress testing. So, it's really a great mix of different things that I do throughout my day, which is why I think that's what has kept me going. Beyond where I'm practicing now in the hospital, I'm actually on call today in my office. I also do other things nationally, and I think that's something that I have told my junior colleagues, that you always have to think outside of the box. So don't be pigeonholed into where you are currently, but try to expand outreach. So if there's an opportunity, if you're in high school or if you're in pre-med, to participate in outreach in terms of volunteering, like what this organization sounds like they're doing, outreach to help underprivileged groups. I think it's very important to do that. It's not just for looking good on your resume, but I think it also gives you fulfillment in that you're doing a greater good to help someone. So that's basically my journey. So in terms of other things that I did, in high school and going into medical school, one of the organizations that I volunteered in, and that's how I met my now husband, was the Leo International Volunteering Organization, which is an international organization. It had a chapter in Jamaica. So we actually, through that involvement, we did a lot of things such as having health fairs. We also visited children's homes, and we donated food, clothing, and that was really where my itch for volunteering started, was then back in high school into medical school. And also during my medical school years, I had the opportunity to do what we call an elective, which is a 1 month stint outside of your medical school program anywhere around the world. I had the opportunity to do an ophthalmology elective for a month at Bullock-Palmer in University of Miami in Florida. That was also another way in which I was able to develop an interest in ophthalmology. And I really also had the other half of that period was also exposure to cardiology, where I was able to shadow in the cardiology intensive care unit. And that was another eye-opening experience. And as I had mentioned during my story, I had also done some shadowing in medical offices in Florida and an internship. So in terms of a typical day in my career, so I'm gonna play this video. Or hospital, as a part of marketing, have each of the physicians create a video, and this is what I'm gonna play next. So I'm just gonna play that video. So hopefully it works. Let's see. Oops. Let me go back. Sorry. So I'm the director of the Women's Heart Center, as well as the director of the non-invasive cardiac imaging network. I have a special interest in women's heart health, but I do see all adult patients who come in with heart disease. Ahead of the visit, ask yourself, what are my goals for this visit? What do I want the doctor to address for this visit? Also, have an open mind in terms of treatment. I know many times patients come in with lots of information that they hear from the internet, from the TV. They heard that this is not good, that's not good. Let's have a discussion about it. One of my things I always ask my patients is, do you have my business card? Because that's very important, because the visit does not end at when that patient walks out of the door. Regardless of whatever else is going on in the environment around you, there's still that patient-physician interaction that is vital, and that's something I just cherish. My dad actually is a physician, so he still practices back home in Jamaica. I grew up and I saw how he went out to work every day and made people feel well. That's what really drew me into this field. I couldn't see myself doing anything else. I actually entered my first month being pregnant with my first child, so I actually got introduced to the Echo Lab a month before that. What drew me to that area was just the ability to just see the heart in so many different dimensions. You can use an ultrasound to take a picture of the heart. You can use nuclear imaging to look at blood supply to the heart. You can also look at CAT scan and just look at blood vessels. And that's something that you couldn't do 30 years ago, to actually look at a picture of a blood vessel in someone's heart without having to open and put catheters up there. I thought that was just phenomenal. Patients, I think, appreciate with the history of just the board not billing patients, and know that you're not in it for the money. You're in it because you want to be here and take care of the patient. I think that first and foremost is what drew me to the hospital, and I think that's what keeps me here. Just the level of gratitude that the patients have. And it has nothing to do with me being the physician and that person being the patient. I think I look at all of us as being human beings, and we're just trying to go through this life together. So typical day for me starts with waking up, getting the kids ready, which is a feat because I have a four and a half to become 5-year-old soon, and I have a 10 and a half to become 16-year-old soon. But of course, they don't have the urgency that, okay, mom needs to get out of the house. So that's my challenge, is getting out of the house. So once I get here, I drop the kids to school. I get here, I usually start off in the clinic. Some days I'm in the echo lab in the morning. On Mondays, I have the fellows conference where we teach them nuclear cardiac imaging, CT imaging. So usually in the evening, the day winds down, I actually get time to go back to my patient messages. So usually I'm here till probably between 5 and 6:37. I also do exercise. That's something that I try to stick to religiously. The last 7 years I've been actually doing boxing and kickboxing, and usually very surprised that a lot of females and all ages, young, very young to very middle age are there. And it's just very cathartic being able to, take out on that punching bag, and also get your heart pumping and get some exercise in. We try to do some outreach. We try to also take the kids to the park, and of course I go to my church every Sunday. So I definitely miss back home. It's different because life is simple there. I mean, you of course have the niceties and technology there, but you can also unplug and just not look at your phone, not look at your computer, and just get back to just talking to people. And the food is awesome. That's without saying. Yeah, definitely. All right. So hopefully you guys enjoyed that. So that's a little bit about my story. And what I'm going to be showing you here is just some images of what we typically see on echocardiograms. This is just a picture of someone's heart, and we look at it in varying views. So this particular patient has a little bit of fluid around the heart. The heart is a little bit thick, and we look at different structures. This is actually the valves of the heart, and also the color. We put color Doppler, something that we for ultrasound looking to see the valves leak and other things. And this is actually a 3-dimensional view of the heart. And we also do latest technologies in terms of looking at how well the muscle is working. It's called strain. So this is what this is showing here on an echocardiogram, typically that we read in the echo lab. This is just an example of what we call nuclear stress testing. So basically, this test looks at blood supply to the heart. So in this particular case, the patient's blood supply is not bad, it's good, but we also look at other things in the stress test. So this particular patient had exercised for a very short time. She also had chest pain when she was exercising on the treadmill, and had some EKG changes that were very concerning. And we took a CAT scan of her heart as well. And she also had a lot of calcium in the vessels of the heart. These colored images that you're seeing within the vessel, that's actually calcium in the heart. And that's a sign that there is what we call atherosclerosis, hardening of the arteries. And because of these findings, we actually had taken this patient to the cath lab. And lo and behold, the patient actually had very tight disease. So these are the 3 major vessels of the heart. This is the one on the right side, we call the RCA, which is right coronary artery. And then this is the left main. This is what we call the widowmaker, which is the main vessel of the heart. And in this particular patient, you can see that this patient had a very tight blockage here, and also in the right vessel. And this patient wound up having 4-vessel bypass surgery. So very interesting in that you you can capture these patients, you can diagnose these patients and actually save lives. And this patient actually had a good pumping function of her heart. So it was very fortunate that this patient actually got this diagnosed before they had a heart attack. So this is why it's so important that of what we do of testing and actually diagnosing patients earlier in the disease. And this is a CAT scan of the heart. This is what the heart looks like on a CAT scan, the left side of the heart, the right side of the heart. This is what we call the mitral valve, which is a valve on the left side. The tricuspid valve is here on the right side. And this is actually the muscle of the heart, and the various, these are the lung fields on that's outside of the heart. And the aorta, which is a large vessel that supplies the rest of our body from the heart. And this is the beauty of cardiac imaging. 30, 40 years ago, as I had mentioned in the video, the concept of being able to look at someone's blood vessels of the heart without doing an invasive procedure like a cardiac catheterization was not even thought of, right? And now with technology, we're able to actually, through a CAT scan, we're able to image these patients' hearts. We're able to find blockages in this particular patient. There's a lot of calcium in the vessels of the heart. There's possibly a blockage here in this vessel. So it's very almost mind-blowing that we're able to diagnose these patients without having to do like an invasive procedure. So I don't know if any of you guys in the audience have had family relatives who have had these tests, but very, very interesting being able to do this. So what attracted me to the field of cardiology, as you can see from the images that I've shown, is that it covers many areas, cardiovascular disease. It covers not just the blood vessels of the heart, but also the valves of the heart, their electrical circuitry of the heart, what we call arrhythmias, when you have abnormal heart rhythms. So I always think of the heart like a house. You have the plumbing, which is the vessels that supplies the heart. You have the walls of the heart, which is the muscle that I showed on the CAT scan, the valves of the heart. And then you have the electrical wiring of the heart, which is the electrical signals that the heart gives to be able to beat synchronously every day of our lives, right? The heart is the most important organ in the body. And I'm not just saying that because I'm a cardiologist. It's the sort of the engine of what makes our body works. And that's why that's what drew me to the field. So it's not just looking at blood vessel blockages and imaging, but there are also other areas of cardiology like heart failure. There's a specialty called heart failure where those cardiologists are taking care of patients who have a weak heart muscle. Sometimes they may have a very thick heart muscle, what we call HCM, which is hypertrophic cardiomyopathy. Sometimes they may have amyloid, which is another reason for a thick heart. So those cardiologists take care of those patients. Then you may have other cardiologists that specializes in actually doing procedures like doing like cardiac catheterizations, putting stents in. That's interventional cardiology. Lately, we're now able to even fix heart valves through doing like a cardiac cath without having to open that patient's chest. That's called structural heart disease. Our specialists, and that's another area that has developed in cardiology. There are also other areas like congenital heart disease. Those are cardiologists that specialize in taking care of patients with heart birth defects, and that's another growing area. There's also in women's heart health, cardio OB, where you're taking care of patients with heart disease who are pregnant and being able to guide them through the pregnancy. And then there's also cardio oncology, where you're taking care of cardiology patients who also have been treated for cancer, because what we're learning is that a lot of the treatments for cancer can impact the heart later on in life. So lots of varying specialties within the specialty of cardiology, and that's what makes it so interesting. So just a little bit about the mentors and those who have guided me along the way. I always I'm very thankful for the opportunities that I've been given, and it's very important that you show the gratitude through succeeding and being able to build on the opportunities that you're given. So or back in New York at SUNY Downstate, Dr. Luther Clark, he was the chair of cardiovascular medicine and our fellowship program. And I can tell you, within New York City, we were actually we're 8 fellows per year for a 3-year program, so 24 fellows. And at the time, back in 2006, I would dare to say that we were probably the most diverse fellowship. We had, in my class, we had of 8 fellows, I think of the 8, 5 of us were minority fellows, and I think that's a major plus. And this is all owed, I think, to Dr. Clark, who actually, was a great sponsor for us and able to shuffle us into the field. And I think in terms of other mentors that I've had through cardiovascular fellowship, Dr. Jonathan Marmer, he was actually then the director of interventional cardiology. He was my first mentor that had allowed me to publish my first peer-reviewed article at the end of residency. And he also wrote me a very strong letter of recommendation for my fellowship program. Dr. Judith Mitchell on the left, she's actually a heart failure specialist. She had really helped to encourage me to participate in research, presented abstracts, and she was also the one that had opened my eyes on advanced cardiac imaging and being able to apply for the imaging fellowship that I did after my general fellowship in New York. Now, through a cardiovascular fellowship, I actually had an opportunity to meet other great legends in the field beyond my institution. And I think one of those opportunities that was afforded to me was through the American Heart Association. Back then in 2009, they had a Women in Cardiology Trainee Excellence Award where you were selected to attend the AHA and were able to meet national leaders within the field of cardiology, particularly female leaders. And the two that I met back then, 2009, was Dr. Jennifer Meares on the left and Dr. Leslie Shaw on the right. They're both researchers and also imagers and past presidents of professional organization for nuclear imaging called ASNAC. And through that meeting, I still I'm able to I interact with them to this day, several years later. And I think it's very important when you're in the field and even outside of the field to network. And, I think I've always told the fellows that, never be shy to seek out mentors, even outside of your institution. So once I was at my cardiac imaging fellowship for the year, I had exposure to nuclear cardiology, echo, and CT. And this was really, so you have varying levels of training for specialties within cardiology. So there's a level 1, which is the basic training. Level 2 allows you to basically practice independently. And level 3 allows you to lead within the field, like to become the director of a lab. And that was the level of training that I obtained during this year in New York at Columbia. And these are some of the mentors and professors I had during the time: Dr. Gordon DePuy, Dr. Alan Rosansky, Dr. Farouk Chaudhry, and Dr. Mark Sheridan. I think they all were able to, in varying ways, support me during that year in terms of educating, opening my eyes to varying fields of imaging, and also later on were able to write very strong letters of recommendation that allowed me to then get the job I had here in at the Boer Heart and Lung Hospital. So while I started my early years here at the Boer, beyond the job search process and being able to find the job is then to also keeping your options open, and also once you're at your program to really practice your best and do your best in terms of what you're doing. I think it's so important not to never stop learning. And that's something even to this day, I'm always learning, and you will make mistakes along the way. We're human. It's being able to learn from that mistake and being able to expand your appreciation of the field. And I think also in addition to that is maintaining a good reputation, being honest with yourself, being honest with your patients. If you don't know something, when a patient asks you, well, what about this? There's no harm in saying, no, I'm not sure. Let me look into it and I'll call you back tomorrow and we'll have a discussion. I think that's very important. And there are many, there are people within the field that have their egos and they'll say, oh yes, this is what you should do. And even when they're not sure, and sometimes it leads the patient and themselves into a path of issues. So I think being true to yourself, being available for opportunities within your own institution. And I know I'm speaking here at the level where I'm at now, but even in high school, in medical school, in pre-medical school, if you're offered an opportunity, never waste that opportunity, because that opportunity, it may be a small one, but then it opens opportunities for larger ones down the road. And I think your reputation, once that reputation is built, and people, word gets around, and if there's an opportunity, someone, a professor may say, I have this very engaging student, she does, or he or she does a good job whenever I've given them a task, and being able to really shine within your own group is very important. Being approachable and also a team player. So your colleagues as well, working as a team, especially in medicine, that is very, very important. I think, the physicians that I see that succeed in the field are the ones who can engage the team and work with the team and be able to treat everyone with respect. I think that gets you leaps and bounds ahead of everyone else, because being a difficult person, being nasty with people never gets you anywhere, and I think that's very important to remember. And as I had mentioned, being able to learn from your mistakes, because you will make mistakes. In terms of other words of wisdom, I think lifelong learning, networking, finding a hobby is very important. It keeps you grounded, whatever that hobby is, or interest outside of the field of medicine, because mental health is very important for this field. And there are days that are going to be very stressful, and you wonder why you're even here. And being able to step outside, take a breath, and get back to the task later on is very important. Taking care of family and really leaning in, when you're at home, and leaning in on your family members is also very important as well. So it's like outreach, as I had mentioned, for me, these are the areas that I did, like starting a health fair. I also, started a women's heart imaging in women educational program, which I do every year. And then also other activities with the HA and the ACC. Lifelong learning. I think for at my level, there are various organizations that are there that allows you to be able to volunteer your time, being a member of a committee, or leading various initiatives. So these different organizations is also very important. So I think collaboration is also important as well, especially if you're doing research. If there's a hypothesis that you're looking at and you're not sure, I think, getting other students that might be interested and really collaborating with them, and then if you have one particular strength and then you have another colleague that has another strength, and being able to collaborate with that person and being able to succeed and to plan a research project and to be able to deliver on that project is very important. Sometimes that collaboration may not just be at your institution or at your high school or your university program where you're at, but within the same state. If there's another organization that's working on the same project, being able to collaborate with those people is also very important as well. So networking, I had mentioned that both in-person networking, if there are opportunities for you to attend, be it a social, volunteer organization, that's vital. I think collaborating, I mentioned that. Social media, when used responsibly, can be very helpful as well. I am on X, formerly known as Twitter, and it has allowed me to meet other people, not just in New Jersey and the US, but even internationally. But I always keep it professional. I don't post anything about what I'm doing. I know the day at the beach, it's not necessary. I don't get involved in politics. I don't comment, like, or dislike things with politics, because then you never know who's going to be offended. It's not worth the effort trying to be back and forth with people. But I think if you use social media responsibly, it can build your brand. It can also help you to find others in the field as well. So I'm going to speak a little bit about mentorship and sponsorship. So there's a difference, right? So a mentor is really someone that you can lean on for advice. They can give you guidance in terms of whichever level that you're at. and also help to guide your research project or what other initiative that you're doing. Typically, you tend to will require more than one mentor because a mentor may be great for, let's say, a research project that you're doing, but then you may have another mentor that helps you in outreach. So that's mentorship. Sponsorship is different. Sponsorship is really, a sponsor is someone where they may sit on a national committee, they may chair an international organization, and there's an opening for a member opening on that committee. That sponsor will basically nominate your name for that opportunity, and you may not even know who your sponsor is, but then you get an email inviting you to be a part of this, organization or committee. So that's what sponsorship looks like. So sponsorship is actually built on reputation, right? So if you have a great reputation and people can trust that you're going to do a good job, then you're going to get opportunities asking you to serve in varying initiatives. And in terms of the importance of mentorship, especially for females in this field. There are not many females in cardiology, but we're growing and we have a very strong voice. And I think mentorship for females and also underrepresented groups is very important. And I think we tend to not really, as women, sometimes we're shy in terms of seeking mentors. And I think in terms of effective mentorship and sponsorship, you have to make sure that there are critical factors that you have to seek in your mentor when you're looking for a mentor. One is a compatible, someone that you can work with and that has the same interests that you're looking at. Someone that you can trust both ways. They can trust you, you can trust them that they're going to be giving you the best advice as well. And they can trust in you that when they give you a task that is going to be carried out to the best of your ability. You're also looking for a mentor that has an expertise in your area. So if you're looking at, like for my example, cardiology, you want to seek a mentor that's an expert in that field. Another thing is willingness of that mentor to serve, because they may be very well meaning, but then they just don't have the time. They don't have the bandwidth, and being able to find that out at the beginning of the engagement is very important. So when you approach a mentor, you have to have, what are the goals of the mentorship relationship? One, do they have the time? And ask them to be honest. I mean, because if they're not going to have the time, then it's as good as they are, that it may not be worth you taking that person as a mentor, because then it's just not going to be very fruitful at the end. In terms of so we spoke about those four main factors. So I think mentorship, as I mentioned, is different from sponsorship, and sponsors are earned and not really chosen, whereas a mentor is actually someone that you seek and you choose and ask them to be a mentor. These are just some of the mentors I've had. Dr. Martha Galati, she's in California, Dr. Dobala, Dr. Linda Gillum, and Dr. Leslie Shaw. So as you can see, I have many mentors, and even at this level, and it's very important. Now, putting it all together, I think this is a blog that I had written back in 2018, and I think it's very important in terms of what's important once you've finished your training, looking beyond, expanding, your outreach. So I think, as I'd mentioned, involvement in professional societies, at university level, at the high school level, there might be other societies that you can be involved with. Lifelong learning, acquiring new skills, never stop learning. Personal well-being is also important. I touched a little bit on that in terms of finding extracurricular activities, other interests to help with mental health. Sometimes when there's a doubt in whichever area of training that you're doing, even at the high school level, getting a second opinion from a colleague if you're not clear in a particular concept that you learned in your course, seeking out the professors and really getting help in terms of understanding what concept that you're learning at whatever particular level that you're at. Starting new programs and taking initiative is also important. So in high school, in undergraduate, in pre-medical, at the pre-medical level, if there's a program that offers you an opportunity to start a program like such as this organization. I'm sure it was started by probably a high school student or pre-medical student. Don't be shy about doing that, right? Because I think, you know, you may think it's a small thing, but then if it succeeds, you'll be surprised how the success snowballs into greater success, and before you know it, it's you know, it's a great thing. And I think this is an example of what I think, you know, highlights what mentorship and sponsorship is. And really, this is actually a sculpture at outside of the Heart House, which is the organization, American College of Cardiology. And it really highlights why it's so important to lift up those behind you, and at whatever level you're at, high school, lifting up a middle school student, right, if they're of interest. And if you're in pre-medical school, have trying to lift those behind you, such as a high school student, and really helping to be their mentor and to really help them along their way. Because I think that also is fulfilling, and it's never too early to start being a mentor. So just the final few slides here, I'm going to speak a little bit on why all of what I mentioned is so important for cardiology. So unfortunately, in cardiology, there's really limited diversity, both ethnic diversity and gender diversity. We are basically almost a needle in the haystack for women. We represent only 21% of the cardiology physician workforce. And the chokehold in the pipeline really occurs at the residency years, and I believe even before that, in the high school years and the pre-medical school years. And you know, it's a very rewarding field, and we need to have more of you guys in the field. And this is why at the National American College of Cardiology level, there's a very strong initiative in getting more women involved, more minorities involved, and included in this profession. And this is just an example. Of course, for women, we make up half of the population, but yet within the cardiology physician workforce, less than 20% of us are females. Same is true for minorities, African Americans, as is highlighted in orange, Hispanics. Within the cardiology field, we're very few, and this needs to be expanded, and hopefully we can achieve this in the next few years. And this is also another slide that shows that within the medical residency level, as I mentioned, there are at least 44% of the residency class that are females, but yet only 13% of them matriculate into cardiology, and even fewer women go into interventional cardiology. So this, of course, needs to be changed. And that's why the American College of Cardiology have had, and I'm going to get into some resources that I think would be very important for those of you guys on the call. You know, there is actually an initiative that was started approximately 5 or 6 years ago to see how can we engage younger people in the field, women, and also more minorities. And you know, the recruitment is it starts at the high school level into the undergraduate level and medical school level. And I think, you know, in terms of the scholarships that are available with the American College of Cardiology, one is the ACC Young Scholars Program, and this is designed for high school and undergraduate students who are interested in health care science careers. And I did mentor two high school students. One, he started college last summer, and another one is starting this coming summer. And this is actually the website if you're interested in learning more about this program. The applications have opened this month, so if you're really considering this, it's a wonderful opportunity. So it's a selected group once you put your application in, and for this current cohort that will be selected, the American College of Cardiology annual scientific meeting will be in Atlanta, Georgia this year in April. So if for those selected, they'll be invited to attend that meeting. And then it's a 2-year program where you're working with a mentor and really having an opportunity to be engaged within the field of cardiology. So for those interested, very important to visit this website, and I will send the slides, these slides as well. I think I had added these after I sent it to you, so I'll send these again so you can share it with the audience. Another one that's available out there is the American the Association of Black Cardiologists. So they actually have a scholarship and awards for this one. I think is geared for medical students or approaching their final year of school, and it's a $10,000 scholarship. So this deadline has already passed, but it's an annual scholarship. So if that's of any interest, that's another area that that you can visit. Now, the HA also has other programs for middle and high school. So this one is actually focusing on mental well-being and fostering social responsibilities. So another website to attend, to visit is this website if you're interested in participating in that. And the HA also offers scholarships for college scholarships for individuals, for students, high school students who are interested in healthcare fields, and the website for that is actually listed at the bottom here. So in terms of final slide here, in terms of advice and tips for pre-health students, I think it starts at the high school, elementary school, middle school level, being able to select your subjects strategically in high school: biology, chemistry, physics, math, and not just choosing those subjects, but doing well in those subjects. For advanced placement with the AP exams, that would be a major plus to do APs in any of these subjects in high school. Seek out mentors early in the field and really choose your mentors wisely. And once you have chosen your mentor, really making sure to give of your best when you're given tasks with that mentor, because that's what will then open opportunities for other assignments. Outreach is important, so the local HA, local YMCA, if there's a local emergency medical services to volunteer, that's also another good area to participate. Research is a major plus if you have the opportunity to do that. And then also, once you're in college, is really having a wide and broad experience in the sciences, and really a strong pre-med program is important. And I think when you're looking at colleges, you want to look at colleges that have a great pre-med program and great medical school program, because then it's easier to matriculate within that institution than when you have to change to another institution. If there's an opportunity to seek professors who are mentors, that would be very helpful as well. Obviously, for medicine, for medical school, the MCAT exams are vital, and really getting the best grades possible. There's some programs that will actually have almost like a guaranteed medical school program where you do 2 years of undergraduate and then you matriculate into medical school almost automatically. Those programs are very highly selective, very competitive, but if you're a strong student, then I would recommend applying for those if possible. Being flexible in terms of your applications for medical school. The competition can be very stiff, so that the wider the larger the number of medical schools that you apply to, the greater the chances of success. And then once you're in medical school, really performing your best and giving to create and to foster positive impressions, especially with your professors, because that's very important as well when you're looking at residency programs to choose from. And I know I focus on medical residency because that's just my area of expertise. But of course, if surgery is another area of medicine, if you're interested in surgery, being able to apply to those programs early as well is important. USMLE scores are very important as well when you're looking at residencies, because then, for the very competitive programs, you really want to get that best score that you can get on the USMLEs. And I think when you're looking at residency programs, choosing programs where like for me, I made sure that I chose a residency program that had a very strong cardiology fellowship program, because then it's easier to get into that fellowship program, because you're already at the institution, people know you, and it's easier to get strong letters of recommendation that will be looked at. And I think with that, I am finished. I went through everything here. So I know that was a mouthful, so I'll stop here and welcome any questions.
Hello, I have a question.
Sure.
Can you hear me?
Yes. Mhm.
Okay. So you talked a lot about mentorship and sponsorship and how important it is to like collaborate with everyone. I do see the importance of that and I want to implement that in my life. However, I do feel like I have struggles with that. I am like quite a shy person. Do you have any advice on like how to put myself in those scenarios or like what you've done in the past or any books I could read to really help me in that area?
So before I answer that question, what level are you at now? Are you in university, high school?
So I graduated undergraduate in 2017. I'm currently in a microbiology master's program and I'm trying to get into PA school. So I'm kind of in
And
between
right,
pre-PA
right.
and going to school.
Right. So I think if you have it's the easiest way might be to speak to your professors if you have a professor that you're working with to really let them know that you're looking for someone that can help to guide you. And so do you eventually want to go into medicine? You said physician assistant school,
Yeah.
right?
Mhm.
So then do you have any physician assistants at your program or at your institution that you can engage?
I currently not at my program. However, I have connected with some of the hospitals and I'm shadowing there. I have two PAs that I'm shadowing currently. Um, and I'm just kind of like experiencing this like awkward struggle of like, I don't really know how much they want to give to me. And I'm trying to like figure that out, but I want to be like respectful of their time as well.
Right. So I
Yeah.
think, it's never a bad thing to let them know that you're really interested in being a physician assistant. You're looking for someone to help to guide you in that process. Would you be willing to be a mentor for me, or do you know of anyone that you could recommend, so I think being able to be, so sometimes, especially when you're looking for a mentor, you have to really, as I mentioned, be direct, let them know that you're looking for someone to guide you, and these are the goals of what I'd like to achieve with that mentorship relationship. So I would recommend starting there, and then if they're not able to give up their time, then ask them if there's someone else in their field that can help you. And so which state are you in?
I'm in Colorado.
Colorado. Okay, and I think so each and I can speak for cardiology because the American College of Cardiology within each state has a chapter. And if there is if there's a cardiologist at your program, you might be able to even attend those chapter meetings, and through that you might be able to meet other people outside of your institution but within your state. So that might
Okay.
be another opportunity as well.
Yeah, that's a good idea. I'll look
Yeah.
into that.
Are
Thank
you
you.
interested in like cardiology from a physician assistant standpoint? Or
Yes, I really like the cardiology courses that I've taken as far as like biology and human heart. I've really enjoyed and I've really like attached to the information and really liked learning about it. So it is definitely something I'm interested in. So
so even, I mean, a cardiologist can also be a mentor, right? Not because you're interested in physician assistant, but certainly if there are cardiologists in their program or in your network, or someone may know of a cardiologist that they can then align you with, that's not a bad opportunity either.
yeah, that's a good idea. Thank you.
No problem. So has for any other questions from the audience?
Yes, I have a question.
Mm-hmm.
Came on real quick. Hi,
Hey,
my name is
hey.
Chris. So my question was towards if, so I'm not looking into cardiology, but I am looking into women's health, but I also do want to learn more about cardiology. And I just wanted to know if you yourself are looking for any mentors at the moment and what that process would be for us to start that mentorship as well.
Right. So where are you located?
So I'm located in Virginia, but I also do go back to Maryland. I'm in a master's program in Virginia, but my
Right.
family's in so both.
Right. So I right now I have a thing about five my mentees. Sorry, so my plate is full, but
Yeah.
definitely I will share my I think Sahasra has my email, so you can feel free to share it with the group here. If you have any questions or you want to get some guidance on something, I'll be happy lend of myself there, a phone call and email. So certainly. So hopefully that might be able to help.
Yes, and if you know any other people
Sure.
in area that are looking for any mental
Right,
assistance.
yeah, so you're in Virginia. So I do have a colleague at University of Virginia that, she's actually a cardiologist that is she heads the Women's Heart Center there at University of Virginia. I could put you in touch with her as well. So if you send me an email, I can, plug you in with her via email to see if that might be an opportunity that because I think it would be easier for someone that's in your state. Like let's say you want to shadow her or she does a lot of research as well. That might be an opportunity for you as well.
Oh, perfect. Okay. Thank you.
Wow.
Perfect. If you guys have any other questions, this is your chance to ask them. Please do so.
And I had go ahead. Someone is asking a question.
Hi, doctor. My name is Satvika. I'm a first year med student connecting from United Arab Emirates.
Okay,
So,
cool.
thank you so much for your informative session. It was really enlightening. I want to know if you're aware of any international research opportunities that I could get connected to, because though we have some here, it is quite in the local level. So I want to know if I can get connected to other people externally. And one of my fields of interest is, in fact, cardiology, but I'm more keen on exploring other fields and then finalizing my definitive field of interest. So
Right.
I would like to talk to you about this.
Sure. So I don't know of any in you're in the Arab Emirates. That's where you are. Okay.
Like,
Yes. So
sorry, go ahead.
right. But I do have a colleague or two that might be familiar with that area, so I could put you in touch with them as well. One particular, the one that comes to mind is Dr. Aisha Kader. I know I think she's an interventional cardiology. I think at this point she may have finished her training, but I could reach out to her as well. So are you're in first year medical school, you said?
Yes, precisely. In a Gulf Medical University. It's
Mm-hmm.
in Ajman, but I currently live in Dubai. So
Okay.
I'm looking at anything within the United Arab Emirates, if it's on site, or if there's any online international research opportunities, I'm interested in that too.
Right. There's another colleague that he actually practiced in Saudi Arabia as well, which is probably close by that I could see if he knows of anyone in he practices now in Texas, but he was there for quite a while. I think he did a whole medical school, everything there. So I could put you in touch with him as well. So if you send an email just with a reminder of what the request is, and I'd be happy to put you in touch with them.
Of course. Please share your contact information so I can share with you my interests as well.
Sure, yeah. I'll put it in the chat actually.
Thank you, doctor.
No problem. And I think, I had shared the resources that I had from those three organizations, but there's certainly maybe other opportunities within your state. And I think for high school students, even for pre-med students, there are scholarships that are funded by, private entities that, I would encourage if you have the opportunity to speak to anyone in your program to see if there are any scholarships that you might be able to apply to. So it's not just limited to what I have shown here.
I had a question if you don't mind.
Sure.
Hold on. Let me turn on my camera. Hi, my name is Rebecca and I'm an undergrad student. I go to Seton Hall and I live in New Jersey, specifically Morristown.
Oh, yeah.
I thought that the echocardiography that you were talking about was really cool because I've never seen anything like that. So I was wondering, like, how would I be able to kind of put myself to be able to see that in person and really study it because it's just something I've never seen before. And I'm also very interested, like that's the field I want to go into. I want to go into
Cardiology.
cardiology.
Yeah.
Yeah, I just want to be able to like learn about it and know what to look for too.
Right. So you're in Northern Jersey then, right? You're in Northern
Yeah.
Jersey? Okay.
Mhm.
Yeah, so I think one of the closest hospitals to you is the Morristown Medical Center. Are you close by there? Morristown Medical Center and
Y-
right. So I could connect you with Dr. Linda Gillum. She's actually one of the national leaders in echocardiography. But what I would encourage you to do, and if you could send me an email again, I'm actually the incoming governor for the New Jersey ACC chapter, and one of the things that we're looking to do is to engage younger people. So if you're interested in attending or chapter meetings, I think that'd be a good opportunity that I can introduce you to her and also others in the Northern Jersey area to help with. And I think for us at the board, we do have an opportunity for medical school students to do electives here. I know you said you're undergraduate, but if you do go into medical school, we have that opportunity. But for now, I think if you send me the email, I could make sure that we'll invite you to the chapter meeting and be able to network with both Dr. Gillum and anyone else that's in that field.
Perfect. Thank you so much.
And I think the American Society of Echo, so it's ASE, I'll put the website in the chat. I do believe that they may have opportunities for outreach. So it's the American Society of Echocardiography. Um, are you working with anyone at your institution who is a cardiologist at this time or not really?
No, and I was hoping to, because currently I'm also a medical assistant. I was hoping that at my clinic that there would be a cardiologist, but there's only a neurologist right now. And while neurology is very interesting, my sole passion I think is in cardiology.
Cardiology. Okay. Well, hopefully I can connect you with some folks. And so Hasra, I'll send you my slides that updated. I'll send you that this evening so that you can share it with the group as well.
Perfect, thank you. Does anyone have any other questions? So we
Oh,
have,
someone just asked,
yep.
how do you handle burnout? Okay, that's a great question. Yes, I think one of the things that I think has helped me is being able to have that extracurricular activity that you do, and also being able to sometimes switch off. Once I go home, I do not take work home. I mean, I have colleagues that will finish their work at home, reading from home, but I find that doesn't help you because then you don't have a boundary where work ends and where life starts. And I think being able to have clear boundaries, it's important. Having an ability to have some other interests outside of your field is helpful. And I think leaning into friends and family is also important. So building your community outside of medicine is very important. I think, especially with the COVID and the pandemic, a lot of people sort of just sort of you know sort of encapsulated themselves in an inner shell, but then being able to leave out of that shell and really being able to socialize is important. That's what has helped me, I think, personally. And definitely, outreach as well can also help. I think hopefully that answers that question. Another one was could you please speak on how to merge cardiology with women's health, or does that pretty much mean only seeing female patients? So yeah, so definitely it does not mean only seeing female patients. It's so what you'll find, especially for cardiology, being a female, sometimes patients will actually seek you out intentionally, because I've had many patients that will come to me and say, listen, I had to change my cardiologist because I was seeing a male cardiologist. He didn't really understand what, didn't take seriously my symptoms. And I think, patients will seek you out sometimes. Other times, you sort of have to build your brand. And so what I have told patients is that I have a special interest in women's heart health, but I take care of everyone. And and it's almost a natural merge being a female, because there are a lot of jobs that will actually seek intentionally as well female cardiologists, because they do see the need in their practice where patients are coming in asking for those, for female cardiologists. So I think it's almost a natural merging. There's no secret thing that you have to do. I think as a female cardiologist, it will naturally happen. But women's health, I'm assuming that you mean women's heart health. If you're looking at OBGYN, then that's a different field altogether, but we do collaborate very often with the OBGYN group for cardio obstetric patients, for pregnant patients who may have cardiac complications. And then how do you deal with challenging peers and or patients? I'm still learning along the way on how to deal with them. I mean, sometimes, so challenging peers, it happens in every job, right? You have people that are just toxic. And I think being able, especially for women, is to have a line in the sand, right? To make sure that, if you're being taken advantage of, you sort of have to nip it in the bud very early. You let them know that that's not something that you're going to tolerate. And if it's a situation where it's your someone above you, then sometimes you may have to go to someone above that person to really, if it's a situation where it's a bullying or harassment, then there's always a human resource department in your institution that you can go to, and they should be able to take your complaint seriously and anonymously, without any retribution, because that's something that is not legal, right? If you're being harassed. So that sometimes can happen in the workplace. In fact, within cardiology, we had a webinar on that, and there's actually a publication on that, on bullying and harassment in the workplace, because especially with so few females in the field, a lot of times that tends to happen. There's that toxic relationship. But I think one is having a line drawn in the sand, making sure that when that boundary is breached, that you sort of step up, advocate for yourself. And also the other thing too is that if you see a colleague that's happening to, sometimes being able to advocate for that person as well. Dealing with challenging patients, there are times that you do your best, and sometimes it's never good enough for that particular patient. And in that situation, I'm very honest with the patient. I said, listen, I've done everything that we can possibly do to help the situation. Where do we go from here? And you sort of leave it there. The patient wants to see another colleague. That has happened, and I welcome them to do so. But I think, dealing with challenging patients, I think the importance is being honest with them, being open with them, being respectful, right? And if it comes to a point where they are disrespectful, shouting expletives, then at that point you said, listen, we cannot continue this relationship. Let me, have speak to someone in the patient communication department, and we can see if there's another physician that can take care of you, because I think there's no reason for someone to become disrespectful, and that should not be tolerated. We're physicians and we're meaning to take care of patients, but at no time should you be abused, especially when you're being respectful to that person. So that's what has helped me. I mean, but it's something that you'll never avoid. And even if you're the best physician out there, it's something that will happen. So I think other questions. So Sahasra, do you want to go through the questions? I don't know if you want to have any selection in how we answer them.
Yeah, we can just scroll through them.
Them are coming in.
Yeah, so the most recent question. Thank you so much for the information. I'm currently a junior pre-med student at Howard University and currently am interested in orthopedics, but I am open to the other fields of medicine. Would you happen to know of any mentors in the orthopedics field in the DMV area?
Okay, and I'm assuming that means that DC, Maryland, Virginia area. So orthopedics, to be honest, I don't know of any colleagues in orthopedics. But I do have colleagues that are at institutions in the DMV area. I did mention my colleague at University of Virginia, and also I do have colleagues, I think, at George Washington. So if I could ask them if they're in the orthopedics in those programs that are, that could serve as mentors. But that, unfortunately, that's the full extent of my knowledge with orthopedics. I'm sorry. Yeah.
Yeah, and then we also had somebody seeking mentorship in Canada. So if you have any connections with,
So where in Canada are you from? Qatar? Yeah, where are you, close to Ottawa or Toronto? They're not. Yeah, I think I do have a few colleagues at in Ottawa. There are cardiologists, imagers. If that's something that is of interest, or that geographic location is close by, I could plug you in and connect you via email with those persons. Okay, I think someone was just commenting on toxic relationships. So thanks for that response. Oh, Toronto, Ontario. Okay, got that.
Excuse
Okay.
me, doctor, I have a question if you don't
Sure.
mind answering.
Sure.
I'm Chaitanya Verma, and I'm currently a high school student. I'm in the California Tri-Valley area,
Mhm.
and I'm very passionate about pursuing a career in healthcare medicine. And right now I'm still exploring because the fields are so vast. I was wondering if you have any advice on or internship opportunities, or people that you can connect me to within the cardiology region,
Right.
how I can get more
California.
experience.
Yeah,
Yeah.
I do have a couple colleagues. Dr. Martha Galati that I had on my slide, she's at UCLA, and I'm not sure how far you are from that area, but she's actually a cardiologist. She specializes in preventive cardiology and also in women's heart health. I could connect you with her if you're interested. Is that close by to where you are?
It is nearby. Yes.
Okay, all right.
And
Yeah, I think, go ahead.
I think I actually attended one of her speaking webinars. I think she's on either the board of like the
Yeah,
American.
the association. Yeah, she's the president of the Association of Preventive
Mhm.
Cardiology, ASPC.
Yeah.
And she's a great person to have as a mentor, So I could put you in touch with. Did you meet her there at the webinar or no?
Yeah, I got the chance to ask her some questions because it was a panel. She's
Okay.
incredible, well spoken.
Yeah. So again, I can connect you with her. I think, because I think at this level it's important, I think, to network with someone that's local in your state, because then it's a little bit easier. And then as you progress in your career, then you can think outside of the state. But I think getting in touch with someone within the state is the easiest, I think, gateway.
Mhm. Yeah, for sure.
Yeah.
Thank you.
No problem. So someone had asked cardiologists doing cardio imaging versus radiology, how much imaging studies does a cardiologist do? Okay. So I think for cardiology, particularly imaging, so it's, there are four main areas of imaging. One is cardiac MRI, cardiac CT is another one, echocardiography, and nuclear imaging. So I think for cardiologists, we tend to, of course, we only read cardiac imaging studies. There's some imagers that will just do that all day, every day. That's all they do, reading studies. There are other cardiologists like myself where we take care of patients in the clinic on the inpatient service, and then also do imaging. So there are varying degrees of that as well. So I think the main difference between the cardiologist and the radiologist is that the radiologists do not see patients. They're just, reading studies for most of the day. You may have interventional radiology where they're actually doing almost like an angiogram. So that's like a procedural procedural aspect to radiology. But generally speaking, the main difference I think between cardiac imagers and radiologists is that for cardiac imaging, you know, you're not just reading images. You have the opportunity to also see patients, and there are different variations of that. How do you feel about prep courses for, again? So I am a strong proponent of prep courses, even to this day when I have to do any standardized tests, because we do have to recertify. I try to do some preparatory course, but whether that be online or in person, because it really helps to focus on what the questions are like and what you're going to be asked. And I think especially at my level and at the fellows level, I always tell them that when you're preparing for an exam, you have to do it in parallel. One is reading in the subject and then doing questions and doing the board style questions and doing those parallel to each other. Because I think the mistake a lot of people make is like reading and reading all the books and studying all the books. I know the last 2 weeks I'll just spend doing questions, and then they realize that they completely did not approach the exam preparation process properly, and then they're getting a lot of the questions wrong. And I think is a wrong way to do it. You really have to do things in parallel. So from day one, you're doing the board questions and reading alongside, and then doing those in parallel, and then doing the questions over and over again. So if it's a book of 500 or 600 board prep questions, trying to go through it at least 3 times, going from cover to cover with those questions at least 3 times, and then also reading on the subject and doing the preparatory course. I think that's the most successful way of doing it. Otherwise, you know, these exams, they're not easy, and you really have to be very strategic in how you prepare for these exams. So someone said the same thing. Thank you for suggesting a parallel method. Yeah. Yeah. Hopefully I covered all the questions. Sahasra, did I cover everything? And
Yeah, that was all the questions. Thank you guys so much for asking the questions, and thank you, Dr. Palmer, for answering them all so thoroughly. I think we have one more person. My name is
Michigan.
Amari.
Okay.
Wondering if you know anybody in Michigan, because I'm interested in cardiology and some other specialties.
So I do have a couple colleagues in Chicago, which I know is not Michigan, but that's probably not too far. Hopefully, I might be able to connect with them. I don't know if anyone actually. I may have a colleague. He's actually in I think at Michigan State. I believe he's an imager by specialty, and if that's your interest, I could put you in touch with them. So you're in college in Michigan. Okay.
Yeah.
Okay.
I
Is
really
it Mari?
appreciate that.
Okay,
it's
yes.
Mari.
Right. So what I'll ask Sahasra, if probably if you could send me a list of the persons, or if I did send my email, just a quick email of what we discussed and who you'd like me to connect you with, and then I will try to make that happen. But I'm on call this weekend, so if you can send me the emails after the weekend, because I don't want to get overwhelmed.
Would it
while
be
I'm on.
easier for if I had everybody send me the email and then I compile everything with, okay.
Yes, that'd be
Great. So
very,
I'll
that'd be
put my email in the chat, everybody. Instead of sending the email to Dr. Palmer, please send those to me and I will directly forward all of you to her, just so that she's not bombarded with emails and not missing anything. I'll put my email in the chat. So please direct your emails to me and I can direct those to Dr. Palmer.
that'd be helpful. Thanks. And then give me about 2 weeks or so to get all the connections happening. And sometimes I may connect with someone if they don't reach out to you, but I would say give them at least 2 weeks, because these people are very busy people, and they may not respond immediately, so that'd be good.
Perfect. Okay. I don't want to take up too much of your time, so I'll go ahead into the wrap-up session. If you guys have any other questions, email those to me and I can forward those over. Let me go ahead and share the wrap-up presentation real quick.
So I'll stop sharing. I stopped sharing already.
Sorry, give me 2 seconds. Well, thank you guys all for joining our shadowing session today. Make sure that you take our digital certificate on our website for attending. So that'll be a simple 10-question multiple choice based on the presentation, and you'll have 2 chances to pass with a 70% or higher for verification that you are here today. And if you missed any part of the session, you can visit our YouTube channel to watch this session and any of our previous sessions as well. And be sure to catch our sessions every week on our website. See you next time. Thank you for joining Pre-Health Shadowing.